And I remember waking up one night and just like feeling like the presence of God in my room. Um, and like it was like a sweetness, just like a sweet presence. And what I got from that in my body was like, I'm not alone. We're not alone in all of this.
Super excited today to be talking about grief, trauma, and trauma specifically around suicide and suicide loss. I have Dr. Garbuz. I'm sorry. We can call her Alina. And very excited about your professional education and how that brought you into kind of world research on grief and trauma. And you were just telling me how your specialty kind of picks you. So let's start there. I'd love to kind of hear that story.
I'll start with when I was in private practice in 2017. That is when I decided, I'm ready to pursue my PhD. I've always liked being in school since I was little. I've been a bookie, so I like books. And I think education gave me order to my life. And so I pursued my doctorate in 2017. And ironically, I started it then, 2017, fall. I started the Beautiful Minds Project nonprofit then too. And then it was around that time that my practice started filling with people who lost loved ones to suicide. And I actually remember talking to my professor, Dr. Tefovin, and I was like, I do not know, there's not a lot of resources for working with suicidality, let alone suicide loss. So long story short, as the program went on and life went on, just doing my own reading and my own study, when it was time to do my dissertation, that is what I ended up picking. It's not what I wanted to pick, but it like demanded to be picked. And so, I feel like the dissertation almost like wrote itself. Like it took me on a journey. I had so many questions, didn't know where it was going to go. And then it ended up turning into essentially a program development. So I took all the kind of the research, the literature that is already there, and put it together into something that could be, I guess, edible for people. So I actually turned that dissertation and the program into an online course. It's free. It's on my website. And so I think it's delightful. It was the first kind of course I've ever done. So I probably say too many but it is what it is. My dog is in the background, and that's all that matters. She's sleeping.
Well, a little bit about your journey, and you've alluded to this a little bit, but it sounds like it was also a spiritual journey of
absolutely.
Universal energy, universal decisions. You know, a lot of people who follow me have lost a child, probably some to suicide. And, you know, we talk a lot about how difficult processing that grief is. And suicide seems to have like even an extra layer of like they made that choice. Can you talk a little bit about like your spiritual journey in what, you know, how you've grown in that area and how you help?
Absolutely. I think this is my kind of experience, but I think it chose me. Probably because of my spiritual journey. Donald, I think his name is Khaled. He writes Trauma in the Soul, and he says when you're traumatized as a little kid, the spiritual kind of recruits you, and I think that's been the strongest part of my life since I can remember, and so. The reason for that is because you swim in mystery. I think it's easier to swim in mystery than not. You know, that's just one of my perspectives. And so with that said, I remember really wrestling with these ideas of like free will and choice, and then like the complex world we live in. How free are we? And then how interconnected are we to the decisions of others? And you know, there's a lot to say about that. And so I think like since I was a little girl, for just reading being so curious about why, always why, like why this and why that, and why, why are people mean, and and watching my parents work through their own histories and their own childhoods and etc. And so, so I think the spiritual, and to define spiritual for me would be what we cannot see with our maybe five senses. So I don't think the spiritual has its own place. I think everything is spiritual. And so with that said, it was my kind of wrestling with these big questions of like, what happens after we die? And, empirical natural sciences cannot give us an answer there. That's not what they're there for, right? And that's why we have theologies and philosophies and literature and the arts and music. And when you put all these, I like to call them sciences together, they kind of start painting a picture for us if we're willing to look at it, right? And so when I look at this picture, what I see is that we are eternal beings in a physical body. And I think, I guess we'll just go there and whatever. I remember this one night, this was 2017. No, it was 2018. Half my caseload was people in therapy because they've lost a loved one to suicide, and then who are struggling then with do I want to be here or do I want to tap out? And I remember there's no answers for this, right. For those who are asking. And I remember waking up one night and just feeling the presence of God in my room. And it was like a sweetness, just like a sweet presence. And what I got from that in my body was I'm not alone. We're not alone in all of this. And I remember just having this sense of no matter what happens, what choices we make, because our choices, yes, we do have free will, and our free will is confined to, I believe, the transformation of our mind that is dependent on the things that we pursue, but also the things that have been, the cards that have been quote unquote dealt. Frederick Buechner always says you're dealt cards in life, and it's about how you play with the world, right? So I can't control who I'm going to lose, what disease I'm going to get, what the things that are going to happen to me, but I get to play with the world. But I think our playing with the world, taking these cards and trading with the world, is dependent on, the expansion of the ideas that then teach us how to play with the world, right?
Well, and this is why I went straight into that question with you, because I could feel the spiritual maturity just in the little conversations that we've had. And this is a pet peeve of mine in professional psychiatry and psychology, is that we say your spiritual health is not part of your mental health. Right. And it is so intertwined. Like you said, everything is spiritual.
Yes.
And I remember, and people who follow me know kind of the story of when I lost Reggie, prior to losing Reggie, I had a pretty strong theology, right? And I did have a relationship with what I call God, right? But the first encounter I had with my son after his passing, he said to me, "Mama, you think you're so smart. You have no idea." And just of that magnitude of the universe and the contentment and that there is so much that we can't experience with our five senses, right? But if we're open to it, we can, to some extent, work on that ability to do that. And so that's why I dove right into that spiritual question, because I think we have to talk about it when we talk about grief, right?
Yes.
And this is in no way the same as someone who has experienced grief as a result of suicide. But I do believe the night my daughter died, she chose to go, and there's this, kind of spiritual, universal energy and context that we don't quite understand. And in our fear of people proselytizing a specific belief system, we don't explore our spiritual health. So that is my challenge to everyone who follows me, especially people who have lost a child. Like, you have to, part of the healing is opening your heart up to eternity and whatever that, however you get to experience that.
Absolutely. Absolutely. I mean, I love that. Most of our education here in the Western world is like a post, Cartesian education, where they split like the spirit, the mind and the body, really, which is spirit and the body, and originally for, I think, good intentions. And then our field largely is dominated by a mostly materialistic humanist worldview, and humanism believes that like we are the ultimate say. And I think somewhere along my journey, I realized like I definitely have no ultimate say. No.
Well, let's talk about that journey. Everybody kind of gets into mental health, for a specific reason, or going through some things. Tell us a little bit about your life, and I know that you are from Ukraine. There are, and we could even kind of talk about cultural grief and trauma, world grief and trauma, collective grief and trauma that we are all still holding on to.
Yeah, I was born in Ukraine, in Smila, Ukraine, which is in Cherkasy Oblast. So for now that most of the world knows where Ukraine is. When I first started college, when I was 17, and I remember during college weekend, one of the students was just like, "Is that by Washington State?" And I'm like, "No, that's in Eastern Europe." But nobody knew Ukraine. Ukraine's just like a little, I think, a humble kind of villagey, country with a heavy collectivist history. And we moved to America in 1995. So after the Soviet Union collapsed, and then at that time, the doors were open for any form of religious persecuted persons, politically persecuted persons. And so we came to America then. I was almost 8. And I grew up in an interesting culture where the Soviet Union, in the way that it was not very pro-individual. So it was very pro-collective. Like, it's all about the collective, and it's all about the collective mission, and etc. And so moving to America, which is the land of the free, of pursuing your dreams,
and everybody gets to be an individual.
Everybody gets to be an individual. Of course, that was like, and so I think a lot of our living here was figuring that out. Like, you get to make choices. You get to choose your doctors. You get to choose where you go. You get to choose. Like, and it's like, so many choices, right? And so, but my parents always told us, like, they didn't get to have an education. They didn't get to choose. And so they encouraged us all. I have 5 siblings, so there's 6 of us, born in 7 years, so we're pretty close in age, and close in general. And so they just encouraged us, like, learn, just learn. Like, everything else is but learn, go to school. And we did. We went to school. And so I think the learning, I grew up in a culture where, like, you just didn't know. You were confined to what you thought you knew. And
aren't we all?
Yeah, and
right?
I've learned not to judge. When I was young, I had so many negative feelings towards everything I came from. And then as I matured, I was able to see people do what they know, what they think they know, what they think is true. And so the one thing we get control over is the mind, our conscious self, and then this body that we get. We don't ask for it. And this body has thousands of years of genetic imprint and our DNA. And so this is what I get. And the question is, what am I going to do with it? Right. And so I think when I finally started learning that, like, I don't get another history. I don't get another people. I don't get another set of parents. Like, this is what I get. What am I going to do with it?
Right.
How am I going to play with this? Again, trading with the world, and education, reading, getting curious about how things work, really helped me with that. I fell in love with neurobiology and the sciences pretty early on in my career. When I pursued my master's, I had a really wonderful mentor who's now my friend, Dr. Kelly James.
Mm-hmm.
And I remember working in an inpatient hospital for kids.
Mm-hmm.
We called them RAD units. Right now we know that those
Mm-hmm.
kids did not have RAD.
Mm-hmm.
They all had developmental trauma. But then it was called RAD, reactive attachment disorder. And I remember just not knowing. I'm just like overwhelmed. What is
Mm-hmm.
happening? And Dr. Kelly introduced me to the world of trauma. And she said, there's therapy and then there's the world of
Mm-hmm.
trauma. Because I remember telling her nothing that we've learned in masters helps me here.
Mm-hmm.
And so that was kind of my little door. So I feel like the world has always opened doors and I just chose to walk through them. And part of that was curiosity, awe, wonder, and a little piece of my story wanting to make itself, wanting to be made sense of through the doors that were open.
Mm-hmm.
And I think a lot of doors were open and I could have chosen any of them, but I chose the ones I chose.
Mm-hmm.
And then they took me here.
Yeah.
So I'm a big believer in trying not to control life too much.
Mm-hmm.
And instead of being possessive of life, instead we're invited into life. And
Mm-hmm. I need a little more of that.
Yeah.
I try to identify and then fix a problem.
Yes.
Which, I realize as I'm getting older, you can't
Yeah.
fix most things, right? You have to, and so I'm trying to learn the art of
Yes.
just being present and
Yes.
accepting.
Yes.
But let's talk about trauma, right? This is, in the US, I think it's this, now it's everybody has trauma, and that's true. I mean, we talked about, generational trauma and these imprints that do impact you in some ways.
Yeah.
But then, on the other side, are we, like creating a victim mentality of, oh, now we have trauma, it's impacting us. We can't. I see kind of some of both.
I have a maybe controversial opinion of my perspective. I don't believe everybody has trauma.
Okay.
Being a traumatologist, I think we've gotten a little confused about the difference about a traumatized nervous system and then distress and shock and difficulty and stress and pain and suffering and etc. I teach my clients that a traumatized nervous system is a nervous system that has experienced experiences that were not taken care of, and they overwhelmed the nervous system's ability to optimally function. And the nervous system is stuck there. So when you're doing trauma work, you're essentially trying to reset the nervous system. That is not the same thing as going through distress and stress and chronic stress, acute stress. And then we have the good stress, which is,
say that again, because people don't know that there's such thing as good stress. Like,
if there's no stress, we cease to exist. I think most people don't know that we live in a world of invisible viruses. There's probably millions of them that are constantly stressing out the system that is the universe. And the function of stress is to actually shock the system so that it could kind of like strengthen. So stress and rest create growth. We understand this when we go to the gym. Nobody like shows up at the gym and takes a nap there and expects to have muscles when they leave, right? Like you show up at the gym and you know that you have to choose weights that are appropriate for you now. And then the more stress you put on your muscle, then you rest, then it grows. Now, if you show up to the gym and you pick up a weight that is too much, or a weight falls on you and it crushes you, that would be kind of like the trauma on your body. And so I'm a big believer in moderating and choosing stress so that I expand myself, so that when life does happen, wars and losses and deaths, that my nervous system doesn't collapse under that. And I believe collectively we are responsible to create space for each other to be able to go through stressors and help each other, instead of, we live in a society, generally speaking, that God forbid you feel any pain and that you're triggered, and that, and because we so control that, now we have these fragile nervous systems that crumble. But stress is going to have, the whole universe works with this is like a
Right.
law.
Right.
We have to stress ourselves out. So when there is no stress, we cease to exist. We die. Cells need to stress to grow. So therapy, I always tell people, we put you the trauma reprocessing process is to stress out your cells so that they can quote unquote be reborn, you know, and then find their new bandwidth, you know?
Bandwidth.
Yeah.
Yeah.
And so I tell people, you either choose your stressors or they will choose you.
Right.
There is no like neutral. You don't get to just sit out. Like if you're a human being, you're called to participate. You can't be like, nope, like I'm just gonna, like that's not an option.
Yeah.
You will choose your stressors or they will come after you because that's how to be living. That's what to be living means. Every living thing is stressed out constantly.
Yeah. I really like what you're saying. You're saying it very differently than I say it, but it's definitely in line with what I try to treat. And a lot of my frustrations professionally is some of this, you know, everything is trauma and I, you know, I can't, and a dependency on therapists and this kind of stuff. And so I'd love to dive a little deeper into trauma. And I know you are certified in EMDR, more like a master level, correct? And as a professional who refers to EMDR, I've seen two things happen, and I'd love for you to explain it from a professional perspective. One, someone is so dysregulated that I think they're not ready for EMDR, and then they just kind of open this Pandora's box and don't have time to put it back together. On the other end of the spectrum, I have had people who have had great results with EMDR, and then the therapist keeps kind of trying to go deeper. And well, you know, let's work on your relationship with your mother, or let's, you know, and then it kind of micro going deeper and deeper. And I kind of think it's not necessary. Like those were not big T trauma. I don't know how you what verbiage you use, but. And so again, I feel like it's creating this dependency on, oh, well, you're never going to be fixed, right? You just have to keep working on the next thing and the next thing. And so you seem to have a really good handle on trauma. So talk to me about those two scenarios that I see clinically.
Yeah, well, I think it starts with how we see ourselves. And I like to tell my clients, we are not robots to be fixed. We are universes to be explored. And that's not just like poetry. That's I don't know how they figured this out, but we have more subatomic connections and possibilities within our neural states than the universe, which when you just meditate on that, you become like, bleh, right? So what does that mean? Like I'm a universe to explore, not a universe to control or dominate, like we try to do with a lot of things. So I like to start there. Like, let's fix how I see myself. And so I become a student of myself, right? And I can't learn everything in a 4-year degree. So I see therapy as if I'm really stuck, if my nervous system's not functioning, if I am ceasing to optimally or even a little, you know, moderately optimally respond to the world, then I go see a guide, right? Someone who can help me get unstuck. So I like to see it as, you know, we have these blood clots, and sometimes you just got to remove these big blood clots and the system will just keep doing what it needs to be doing. You know, and so I see therapy, I see EMDR is a really great laxative. Okay. Yes.
I love it.
For everyone who's ever worked with me. Like you are, I like to talk about poop. And so, when we're constipated and because we have consumed things that our body doesn't know how to process, or our lifestyle, lack of sleep, lack of water, this and that keeps us from processing, we just need like a good laxative, like a good senna leaf tea, you know, you drink it. And so what do we know about that? You drink a good tea and it kind of unlocks things inside of you, and you go to the bathroom and, you know, like things come out and then you feel better. But as you feel better, you can't just go back eating to the things that you were eating to get you to that place. Like you have to learn how to eat healthy. So good therapy for me is so EMDR is a full psychotherapy. Where people get stuck is they think EMDR is just the bilateral stimulation and reprocessing piece, but that's only one piece that you have to prepare people for. So for example, if someone comes in, they say to a doctor like, hey, I haven't been to the bathroom in a while and I just feel awful. And so before you give a person a laxative is something that gets things going, right? You got to prep them. You have to prep their body to be able to handle, to process the food that's inside of them. Before we activate and reprocess trauma memories, we need to prep the nervous system. Like prep it to be able to handle the activation of the neural states that hold the cortisol and the adrenaline of these original experiences. Otherwise, what happens is we're sitting on the toilet for hours and we're in pain, and it's just like this is not what I wanted. Or the worst part is you take your laxatives, but your body's like, I don't know what to do with this, so it does not process. And so I think a lot of people go to therapy or they hear about these modalities and they're like, oh, like there's a quick fix. Nothing's a quick fix because we're not fixable and nothing's quick. Nothing good is quick. And so we have to prep people to be able to handle activating states that are holding on the cortisol and adrenaline of these original shocking experiences and to process them with a regulated body. And so that takes time. And then when that happens, you have a good poop, you have a good dump, you don't need to be taking more laxatives. You need to go live life and create new experiences and start eating a healthy, balanced diet and sleeping, working out. And then as you do that, life itself will say, hey, I feel stuck here. I feel stuck here. And so I tell my clients, this is like a forever accompaniment journey. We accompany each other. Let's do some work. Go live. You need new experiences. Experiences change us. Whenever you feel stuck and the tools that you've learned are not helping you, come back and let's give you new tools, right? And then go live. And then so that way, I think we should see our all professionals, doctors, clinicians, as people who accompany us on a long journey, not someone we come in for a fix and we leave. And it's like, think of cars. If you're not maintaining your car, you're gonna need to go back and get it fixed over and over. But if you maintain your car, like I have a Toyota, they have a long life. Right. And so I'm a big fan of maintaining it so that I can pass it on to hopefully my nephew or whomever in good shape and form. So I think we live in a world where, going back to earlier question, I can do whatever I want. And then our bodies are struggling. So then we're like, great, well, I have thousands of counselors I can go to. Fix me now. Yeah. Fix me tomorrow.
I say that 90% of the people that walk in the door, that is the mentality. Yeah. And our vision here is to revolutionize the culture of mental health. And I feel like there's this constant resistance from clients, other professionals, politicians, the way that the system is. Everyone has choices, you can choose to use.
Our entire medical system, this is everything, is built on intervention, not prevention. So I'm a big believer of giving everybody like grace and the benefit of the doubt. If we've been conditioned to see things as intervention, not prevention, we're going to live like that. So for myself, part of my job is to teach people how to live preventively, so that you need less intervention, and knowing that when you do need intervention is there for you, right? And but we do live in our society, at least here, very intervention focused. Like we're not, when people in my life get sick and they go to doctors, they're giving them things to take care of the symptoms, but they're not teaching them how to change the lifestyle so they don't have those symptoms.
So in your studies and just, personally, this journey that you've been on, how much do you think of these decisions, the poor decisions that people continue to make? I mean, even in basic things that we know about diabetes, like stop eating sugar and they keep eating sugar, right? And then there's some people that talk about this as, generational things and, they say generational trauma, but I know we've already defined that not everything is trauma. How much do you think is kind of this collective that we are experiencing, and how do we make that shift, or how do people that are listening make that shift if they feel like, I'm kind of stuck in that?
Well, I mean, we're social creatures, so we prime from one another. We're also like our minds work on ideas, right? So that's important. And then like our nervous system is constantly paying attention to every other nervous system. And so in our eyes, like we are creatures who move in the direction of what we see. So if we're constantly scrolling and looking at how the ideas that TV and binge watching TV and social media is presenting, even if we intellectually may know that these ideas are not good, we're still consuming them. So our occipital lobe, like map, still creates a way we see things. So I think that there's a lot of contributing factors. I think we are all, this is I like to think the balanced individual part of me. I think we're all responsible for each other. Not that we're going to go to like some, hell if we don't. But I think part of having a happy life is taking a proper responsibility for one another, not via control and manipulation, but via how I live. And if I live well, people are going to look and say, oh, like I like what I'm seeing. What are you doing? And then we sojourn together on this journey that is life. But I think that goes deeper to the spiritual part of things. Is I don't think we as humans understand how wonderful we are. We live in a world that's constantly like people are bad and the world's going to hell and everything's so bad. But humans are amazing. Like go to a war zone and watch how people take care of each other. And yes, there is evil, but there's a lot more good. And so I think there's many low-key problems, but I think the core problem is we don't understand our worth and value as a human. And that me being healthy isn't just not to have diabetes, but there's like a destiny inside of me. Robert Greene, he's a neuroscientist, and he talks about this in Mastery, that in our DNA are prints to a destiny. And how can we listen to that and tune into that if we are so busy being fatigued, stressed out, burdened with all this stuff, like the rat race that is life. And so I think the symptom is, diabetes and whatever, all this stuff. But I think the root issue is we don't value ourselves, therefore we don't value one another. And how can we can't give something we don't have.
Right. Yeah. And I've been on my little self-love journey, midlife crisis after losing my children. And I realized, and I teach this, like you have to know yourself and then like yourself before you can love yourself. I think we talk about, self-love and, it being some sort of getting what you want and, going on vacation and getting your nails done and things like that. And those have not, there's been very specific things that fill my cup that if I wasn't looking for it, I wouldn't have known, and so, learning to love ourselves.
And I think love, I see in our society, we think love is fluffy things, but love is actually the hard things. Loving myself is actually saying no to staying up late. Loving myself is actually going to the gym when I really just want to not. Yeah, loving myself is saying that I got little humans who are watching me. And to the degree that I'm tired or fatigued or moody or have an attitude or whatever, is to the degree I cannot give them proper love and attention. That's loving of myself, and in our society, I think a lot of what I hear is, self-love is that glass of wine and that bat. Like, no, that glass of wine is killing your brain. And so I think self-love is actually synonymous with a lot of discipline. And choosing the stressor of saying no and doing the hard things and essentially walking that narrow path that most people will not walk on because it's not easy. But I think when you do it, it becomes the easy path because you create habits that then help you float in life, a flow in life, instead of.
And this is one of the downfalls of living in a culture where, yes, you have a choice for everything you do. But that also means you can make a lot of bad choices.
So our job is to live making good choices so that the little humans in our life can learn through us how to make good choices, how to choose, right? And I think in our society where I'm a big believer in I need to take responsibility for my own self before I try to fix the world. And to the degree that I'm responsible here is to the degree that I can handle being responsible somewhere out there. And, but I think it's flopped sometimes in a world like ours where we want to control everything on the outside, you know, and, but really it's always an inside out job.
Yeah.
It'll always be an inside out job.
And it's a lifetime journey. And that's why we call this podcast Embrace the Journey, because you're on it. You might as well embrace it. And you're not going to just fix yourself. Like this is, you know, the whole lifespan, and we're supposed to be doing something.
And
with
seeing like you get to be here, like you get to, you are a scientific miracle. They have no idea how, you know, they see how when an egg and a sperm come together and the light comes on, like they don't know how, like we don't, you know, and it's just like, how do we start with, I'm a miracle. Hello. And I get to be here in this time, in this age, in this world with the things happening. And then I get to play with that. Like, how can I play with that? You know, I don't have to, but I can. And so I think that's the childlikeness in us. Children play with what they have. When we were in Ukraine earlier this year, watching the kids. So our colleagues, they bring their kids to wherever we went. Like kids were part of what we did. And so it was fun to watch them, you know, like there's bomb sirens going off and, you know, just shenanigans. And the kids are just playing sticks and stones and like, because the adults are there and the adults are regulated. And so when the adults are safe, when the world feels safe via the adult, no matter what's actually going on, what do kids do? They play, they explore, they make things happen. And I think our job as mental health clinicians, or I like to call myself and my friends in this field as doctors of the soul. Our job is to light up the soul again so that we can be childlike. And instead of freaking out with all these terrible things going on in the world, we say, how am I going to play with this? What am I going to do here? It's an invitation to come and create some change via the motivation of play, you know, and that is in no way dismissing the hard stuff. That's actually how you keep yourself regulated. I have a choice to play with what is happening in the world. I'm not living somewhere. This is where I am. And so kids, I feel like, are my actually greatest teachers in life, because they teach you, like they remind you what you're here for. And so the kids in my life have taught me that, well, you get to choose to play, you get to choose your tribe, and then you just like, how do I have fun in a world that has a lot of we live in a world with a lot of evil. I know a lot of people don't want to believe that, but we do.
Well, you know, what's interesting is as you're talking, I'm always digesting, you know, personally and how that impacts my life. And I actually had an experience this morning. My grandfather woke me up at 4 a.m. and my grandfather has passed, right? He clearly called my name at 4 a.m. And I'm sitting there asking him, like, what do you got to tell me? Like, what is going on here? And he was a very safe presence, right? But I would not say the same for my grandmother. She was very emotional, reactive. My mother, the same. My biological father died when I was young, so he was the only man in my life. And, you know, I've always thought of him as kind of this stable. And all he really told me this morning is like that, be more like me, basically, right? And which I'm not. I'm more like my grandmother and my mother. And as you're talking, you know, I realized like that is the safety that I didn't absorb. I absorbed the chaos rather than the safety. So you just helped me process that experience.
Yes. But that's why when you say that, I think of like how many others will find that safety via me that I'll never know about.
Right.
And that's the fun part of life, is we get to turn on the light in other people's souls. And a lot of times we don't know it, you know? And so how can we live in such a way that like we're being watched, not like watched, but like we're all priming from each other. We're all, you know, like the nervous system moves towards the safest nervous system. And so how can I be the safest? How can I be the most resilient, you know, or, you know, just to use those terms, nervous system in the room? for those who are struggling in their nervous systems. I like to use the word nervous system, well, because we are a nervous system. We're more than that, but we have a nervous system. Because a lot of times in our society, this is not a new thing. We have learned to moralize or demonize things. You're struggling. But really, if we started seeing that we all possess a body and we all have, our bodies have different bandwidths. And so if my body has the ability to, maybe stay more regulated in a circumstance and your body does not, I'm going to take on joyfully the responsibility to help your nervous system kind of rise to the occasion. I'm a big Tolkien fan. And one of my favorite pieces of his Lord of the Rings is where, Sam, where Frodo is getting pretty burdened. I'm assuming
I do not, but I'm sure.
That's your
Jada's laughing at me right now.
That's your homework. Go read Tolkien. It's a beautiful story. Lord of the Rings. But, Frodo's on this, he's a hobbit on this adventure, this great adventure that he did not ask for. He could have said no, but if he said no to throwing this ring that was going to destroy the world, Tolkien fans are going to be like, there's more to that. There's more to that. But life called him out of his safety and into a journey, and he chose to say yes, and he had a fellowship that supported him, and then he had a friend on the journey. And there's this one point on his journey where he was burdened by this ring he's carrying. This ring he had to throw into the fires of Mordor where it was created, and it was a ring of a lot of evil and power and etc. And there was one point that he's so burdened by this ring, and Sam, his friend, says, Mr. Frodo, let me carry that ring for you. Because part of carrying the ring is the ring's evil wants to infiltrate you. And so why Frodo was picked for this journey is because he was his, let's just say his soul was so innocent and good that he was not as infiltrated by this ring. But he was feeling burdened by it, and Sam wanted to carry it for him. And he said, this is my burden. And Sam said, okay, Mr. Frodo, I cannot carry then your burden, but I can carry you. So he picks him up and he puts him on his shoulder. And if you watch the movie, it's such a beautiful scene as they're walking up this gloomy, dark mountain. And I love that scene because that to me is the representation of being human in this reality, the reality of good and evil and etc. And I believe that good will always win. I believe there is evil. And how can we, instead of trying to control and manipulate each other's burdens that come along in our genetic imprints and all these other things, and instead carry each other. But to carry one another, I need to go to the gym and lift some weights, metaphorically speaking. Right. And so, if, Dr. Keyes, who's the director of the Green Cross, always says, it is your, ethical duty to take care of yourself as a clinician, because then you cannot be carrying others. And so the goal is, how do I live like that? And then show that to other people. And then we all have each other. Yeah. And then there you go. Heaven comes and all this. The plan.
We get to enjoy that. Yeah. So one more dichotomy I want to have you flesh out here is this this nervous system that we, trying to be the stronger person and helping absorb maybe someone who is not. And we also live in, a culture where we can choose and we quit a lot of things. And you hear a lot of counselors and mental health professionals saying, get out of that toxic relationship. And there's some that are very toxic, right? Yeah. But I think everything can be, feeding, you could have two well-meaning people not wanting to be toxic that are feeding off each other's chaos. And how do you take that step back or, recognize when it's a real toxic relationship and it's not healthy for you versus relationships are difficult.
Right.
And how do we work through those in that supportive piece of strengthening ourselves so that, our energy is helping them as well?
No, absolutely. Well, first of all, again, back to language. Language is important, right? I think just like we overuse trauma, we overuse toxic. And toxic is something that is poisonous and will kill you. So I think we call a lot of things toxic that are not toxic, right? And so toxic is something that will kill you, right? That's why they have toxic, poison, do not enter. It will kill you. This is not a choice of like whether you're strong or not. This will kill you, right? And so I think first differentiating what is toxic and what is simply just like suboptimal, not optimal. Then 2, I believe in the currency. I believe in free will, and I believe in love, and I believe in yeses and nos. And so I'm a big fan of relationships. I get to be in charge of this universe. This is the only thing I have in this life. Like, this is it. This is my piece of land, and this is what I'm in charge of. That's it. And then I get to invite anyone over for tea on this piece of land, you know? And if they're not going to help my piece of land, and I'm not going to help their piece of land, then, you know, like, maybe we shouldn't be having tea together. Right? And so I'm a big believer in free will. And so and I'm a big believer in there's 2 great emotions, fear and love. So to answer that question is, I think out of love, we have great bandwidth. So if you see a relationship that is suboptimal, and out of love, I say, I have bandwidth for this. I have great limit for this. I'm going to stay in this. And I'm going to stay in this using yeses and nos. The yes and no meaning this is what I want, this is what I don't want, and I'm going to respect your yeses and nos. If the other person is on board with that, and we can have tea together and figure out how to live in alliance and figure out how to live linked up, and we like this dynamic, then great, right? But if this person's like, I don't like your yes and no, I don't like the truth that what you see. If we're not seeing the same truth, then you can't be in a relationship. Like it's not, you know?
Yeah, and more than intimate relationships, but like all of parents, right? Other family members, I hear, I mean, I think relationships are the only thing that's eternal, right? We're not taking anything else with us, right? And it's my core value. It's a core value here that relationships are priority. But I often, you know, have mental health professionals saying, well, you just need to cut off your mother. And there's definitely times for that, right? But part of that healing process and strengthening our spiritual growth, our understanding of our purpose, our relationships, these were chosen for us, right? We didn't choose our mother and our father. And so again, that balance of strengthening yourself while maybe still maintaining some of those relationships that, you know, might have created some grief and trauma in your childhood.
Well, yeah. First of all, I am not a big fan of anybody telling people what to do. So I think anytime a mental health professional, and if I've ever done it, you know, like we all want to do that because we're like, just cut that person off. Like that's like a self-protective. It's not a bad part of us, but that's not how life works. We don't learn like that. And I'm a big believer in like, okay, like how can I guide you to make a decision out of a place of love? Love, again, not fluffy, kind of whatever, rom-com, Netflix love. Love is, I have the bandwidth and the limit to keep interacting with you based on yeses and nos. Hey, Mom, I want to keep this, but here's my limit. I don't want to, you know, and the mom can then, with free will, say, okay, I will try my best to do that. And then you are trying to dance together.
Right.
If the mom says no, then I am going to respect your no. That's a place of love. Place of fear is, I don't like that no, so I'm going to try to manipulate my ability and limit until you have a yes. And so I think anytime we're functioning from a place of fear, we've already lost.
Right.
And so really, how do I train myself to constantly be in a place of love? Love is free will, choice, respect, and yeses and nos. Yeses and nos, when I say that, I mean like it's not manipulative. Hey, I want you in my life because you're the only mom I'm going to have. And here's my limit. When you do this, my limit is, it's not good. It's not working. My bandwidth, my window of tolerance, whatever you want to call it, right? And so I want you to be in my life, but here's my limit, which means I need to know myself in order to communicate the limit to you, right? We use the word boundaries a lot, that word like trauma, like toxic has been overused. Nobody knows what it means. So
Right.
Kathleen, one of my colleagues, she says, limit. What is your limit?
Mm-hmm.
My limit is I can't handle it when you yell at me. My limit is I can't handle it when you call me at midnight, and I can't handle it when you call me and complain about my dad.
Mm-hmm.
I want you in my life, but here's my limit.
Mm-hmm.
You present the limit freely, and the person can say, well, you should be able to handle it. Who else am I going to talk to? And so if they say no, I'm going to respect your no. And I'm going to respect my limit. I'm not going to judge you for your no, and I'm not going to judge me for my limit.
Yeah.
And
that's what we do. We judge ourselves for that limit, and then we feel guilty.
Yeah.
And then, we backpedal on that.
And manipulation, which is always going to be a function of fear. So I think really the journey is always we're teetering between fear and love. And how can I move myself into where I can flow in love, and then create a community of people that can help me stay in a flow of love, which is, again, free will, respect, all of these things. But that requires love. That requires for me to honor myself and honor other people, no matter what choices they make.
Yeah.
Even if they're evil choices, I am called to, that's your choice.
Yeah. And it's hard when the choice is you think wrong. If if there is right and wrong, and
I think a lot of people are doing things that I disagree with, and you are in charge. Now, with that said, there's a caveat to that. As adults, we are responsible to guard the little havens that are kids, because they don't have the bandwidth to do that. Right. I'm a big believer that all adults are responsible for all kids. That's not my kid, not my problem. No. You being an adult makes you responsible. To your limit, obviously, if this is beyond, and so I believe when we take proper responsibility for ourselves and others, what we see is more lights come on, and the light always extinguishes the darkness. And I think in our society, we're so obsessed with the darkness, instead of turning on the lights, and the light just does the work. Like, then we don't need to focus on the darkness. Like, all these bad things. Everything's bad. Religion's bad. Politics. Like, bad things will always be there, because choice is a function of love. But if we can keep our lights on, have a lit up community around us, and then invite others into a lit up community, over time, long period of time, it's the slow game.
Yeah.
The lights will turn on, and, and I think, I don't know, I think, like, not to be like a people call like, oh, like utopian thinking, but I think that's the slow way of, like, turning on the lights in the world and creating the world we want to live in.
Yeah. I like the thing that you said about children. We've lost that community piece in our individual culture in America. And, all the research says that the majority of the influence that they receive is from other adults in their life, not from their parents.
Yeah. Daniel Siegel calls it alloparenting.
Okay.
I just learned this not too long ago. And so it's like, back in the day, we had tribes. We were more in community, I think, than now. And everyone raised everyone. Like, the kids were part of a tribe, and everybody was auntie and uncle. In the Ukrainian world, we call everybody dada and teta. Dada and teta is uncle and auntie. And so every adult is a dada or teta, dada, teta, and so in the language, right, like, the community is responsible.
Yeah.
Versus I see in our hyper individualistic, and I'm all about, like, I love
freedom.
Choices. I love freedom. I love freedom, and I will always love freedom, no matter what shenanigans comes along with freedom. So freedom is good. So with that said, I think in our society, we just don't want to see the things that we could be responsible, because it demands effort and energy on our part. But I also think we don't have it modeled well to how we can be more playful. I think that's where joy is. Joy is showing up for each other. And in a country where the pursuit of happiness is a value, I'm all about it. Joy is really the good stuff. Like, it's the stuff of the soul. And so, anyways, no, I can go on and on.
So, let's end with kind of telling us what someone would get from an intensive with you. You know, kind of how that starts. How do you usually get referrals for that? And where do you start with someone?
Yeah, I love intensives because, man, you can read The Flow Psychology by a guy who has a very long name. So just Google Flow Psychology. I don't know which country he's from, somewhere in Eastern Europe. And then, what is his name? I'll remember his name, Cal Newport. And so they talk about how when we stay deep and long in a craft, it transforms us. Any craft, whether the craft is art or music, the longer we stay in something, it stresses us out, and that's where this transformation happens. Intensives are the ability to stay longer and then titrate, pendulate between stress and rest, stress and rest, stress and rest, but for 3 to 6 hours a day in a therapeutic setting. So what it does is it helps us, to say it simply, just do more deeper work quicker, right? Versus it's necessary because it's what we have, but this 1 hour session a week, it's like, hey, how's it going? 15 minutes. And then how deep can you really go? And your brain knows that, well, I only have 15 minutes, 45 minutes. So it naturally won't allow you to go as deep. I do plenty of 1 hour sessions and we get the job done, you know? But the point is, I don't think in our society we allow ourselves to just dive deep, you know, swim in the deep waters and then go home and do your thing. So one of my favorite things to do is I call them like mini intensives, which is I'd rather see a client once a month for 3 to 4 hours. So like instead of once a week, come in for 3 to 4 hours once a month. We'll do deep work, and then you go do. It takes 21 days for really new pathways to be created in our brain, and then strengthen. And so that's kind of my favorite way of doing therapy. Some people will come in for 2 days, 3 days, a day and a half, whatever. You know, and then I see a lot of people for just your typical 1 hour a week.
The once a month intensive sounds, like
and so I think if insurance companies, so insurance companies are not built on what works. So unfortunately, I know that's the system, but again, that's an intervention system instead of a prevention system. So I'm not a big fan of talking about how the system doesn't work. Like there is a system, and we change it by changing the parts slowly at a time, right? And so with that said, right, like different practitioners get to play within the field that they choose, right? So if I'm in this field and it takes insurance, like how am I going to maximize this? Like, you know, again, spending too much time on, the system is ineffective it's not very helpful. Instead, it's like, okay, well, I'm choosing to be in the system. What can I do? Right. So part of what I do is I love my intensives. I have a private practice. I don't take insurance, but I also started an academy where we do trainings. And what I like to do is I love teaching. That was kind of the first thing I did before getting into therapy. And I love to teach because I think when you teach people and you let them go with new ideas, they start innovating. And so one of the ways that I like to work within, you know, our world is to have trainings. And I changed Beautiful Minds Project into Beautiful Minds Project Academy for Trauma Studies and Disaster Response. And we're a Green Cross site. And Green Cross is Green Cross Academy of Traumatology was started by Charles Figley after the OKC bombings. And the whole point of it is to simply like educate and prepare the local community to respond to disasters. And the trainings are very cheap. They're very affordable. Most of my trainings are free. And I tell people like, hey, like, come join us. I do full days of the neurobiology of trauma, working with sexual abuse, working with traumatized persons, disaster response. I have a small fee, but if people want to come, they can come for free. And so I offer that to the community.
Okay.
And that's how I'm choosing to innovate, because it's what I love. It gives me energy. It doesn't take from me.
Yeah.
And then that's what we do abroad when we go to Ukraine or Cameroon, or And so I guess that was like a weird way of answering your questions, but intensive.
And I hope we can work together. Like we're right next door. And I definitely see the spiritual maturity in your practice and obviously professional experience as well. And I'd love to kind of work together on
do some training. And it's just fun, and you bring in people into I like trainings because they're not a therapeutic setting, so people can meet each other while talking about these things that society doesn't, not just society, but that we often do not make space and time for.
Right.
And trainings are usually 6 to 7 hours, so that I call them little training intensives. So we still go deep only as students instead of as patients.
Yeah.
Right. And it kind of balances us out.
Yeah.
But one of my hopes for the future is actually to have a retreat center and then create intensive retreats for different types of groups of people, like first responders and, the intensive retreat I created was specifically for traumatic bereavement. And I love stuff like that. And the hope is to innovate with that.
Yeah.
As the days.
I can't believe you've been right next door for the last 5 years and I didn't know you were there. But I'm glad we got connected. I definitely, I'm starting an intensive as well that is more CBT based, but I would love to bring you in as kind of a guest to do maybe some group work on this trauma, redefining stress.
Yeah.
I think mothers, in general, not even mothers who have lost a child, but mothers in general in this culture of it seems to all be falling on them, are having a really hard time with, taking care of themselves in the midst of their children, raising their children. Yeah.
Absolutely. Most of my friends are mothers, and I have 2 sisters and 3 sister-in-laws, and I watch them and I'm like, ooh, like, yes, like it's a lot.
Yeah.
It's a lot that we're trying to do. And I think a lot of it we don't need to be doing. And a lot of it we could be doing differently. So, but this was lovely.
Yeah. Thank you so much. And all of your information will be in the description so people can find you. Any last words for our audience?
I mean, I guess the last word would be that, like, when you think of therapy or the journey, it doesn't have to be miserable. I think a lot of people think of therapy as like, what's wrong with me? Finally. It's like, no, like we all have to do the journey. We all need to heal. I like to say we're all kind of wounded soldiers of love and we need to heal our wounds, and we heal them together. So, I guess that would be my last.
Yeah, I love it. It's beautiful. Thank you so much.
Thank you so much.
Yes.